Like any other animal, cats can have problems with their internal organs. When it comes to cats' internal organs, some of the most common problems are: 1. Kidney disease. Older cats often have chronic kidney disease, CKD. More urination and thirst, weight loss, loss of hunger, and tiredness are all signs. 2. The urinary tract is a place where cats can get infections, blockages, and an illness called feline lower urinary tract disease, FLUTD. Symptoms include having to strain to pee, having blood in the urine, and urinating in the wrong place. 3. Liver disease. Cats can have liver problems because of infections, chemicals, or metabolic problems. Some of the signs are redness, losing weight, throwing up, and having more thirst. 4. Heart disease. Cats often have heart problems like hypertrophic cardiomyopathy, which makes the heart muscle thicker. Some of the symptoms are shortness of breath, tiredness, coughing, and passing out. 5. Pancreatitis. Cats can get inflammation of the pancreas, which can make them vomit, have diarrhea, have stomach pain, and lose their appetite. 6. Hyperthyroidism. This is when the thyroid gland makes too many hormones, and it usually affects older cats. Symptoms include losing weight, having a bigger hunger, being hyperactive, and throwing up. 7. Diabetes mellitus. Your cat could get diabetes, especially if it is overweight. Symptoms include thirst, urination, weight loss, and feeling tired all the time. 8. Gastrointestinal issues. Cats can have a number of digestive issues, such as gastritis, inflammatory bowel disease, IBD, and intestinal parasites. Some of the signs are throwing up, diarrhea, stomach pain, and losing weight. 9. Problems with the lungs. Asthma, pneumonia, and bronchitis are just a few of the conditions that can affect a cat's lungs. Coughing, hacking, trouble breathing, and stuffy nose are all signs. 10. Cancer. Lymphoma, mammary tumors, and squamous cell carcinoma are some of the kinds of cancer that cats can get that affect their internal organs. Depending on where the cancer is and what kind it is, you may notice lumps, weight loss, tiredness, or changes in your hunger. Cat owners need to keep an eye on their cats for any signs of sickness and take them to the vet right away if they see any that worry them. Checkups and other prevention care can also help find and treat problems with internal organs early on. In the event that something is wrong with my cat's organs, what should I check for first? If you think your cat might have a problem with its internal parts, you should keep an eye out for certain signs and symptoms that could mean there is a problem. Keep these important things in mind. Changes in weight and hunger. Increased or decreased appetite. An abrupt rise or fall in hunger can be a sign of health problems like hyperthyroidism, diabetes, or stomach problems. Weight loss or gain. Losing weight for no apparent reason could be a sign of kidney disease, diabetes, or cancer. It can also be scary to gain weight, especially if it comes with a big stomach. Urination and thirst. More urination and thirst. This could be a sign of kidney disease, diabetes, or hyperthyroidism. Strengthening to urinate or blood in urine. These signs could mean you have an infection in your urinary tract, bladder stones, or another problem with your urinary system. Changes in behavior. Lethargy. Being less active or sleeping more can be a sign of many health problems, such as heart disease, liver problems, or just a general feeling of not being well. Hiding or changes in social behavior. When cats are sick, they tend to hide or spend more time alone. Digestive symptoms. Vomiting and diarrhea. Vomiting or diarrhea that happens a lot can be a sign of pancreatitis, stomach problems, or other inside problems. Constipation. Having trouble passing stools could mean you have stomach problems or are dehydrated. Breathing and heart rate. Labored breathing or coughing. Coughing, hacking, or having trouble breathing can be signs of asthma, heart disease, or breathing problems. Changes in heart rate. If your heart rate is too fast or too slow, it could mean you have heart problems. Physical appearance and condition. Jaundice. Eyes, face, or gums that are yellow can be a sign of liver disease. Pale gums. Gums that are pale or blue can be a sign of anemia or poor circulation, which could be caused by heart or lung problems. Abdominal swelling. An enlarged belly may be a sign of fluid buildup, tumors, or organ growth. Pain and discomfort. Signs of pain. Cats that are in pain may make more noise, act more aggressively, or refuse to move or be touched. Abdominal tenderness. Feeling pain when you touch your stomach or organs in that area could be a sign of a problem. If you see any of these signs, you should see a vet right away. It's important to find and fix internal organ problems as soon as possible to improve your cat's health and quality of life. Checkups and preventative care at the vet can also help find problems early. Thanks for watching. We're glad you joined us to learn more about cats and deepen your bond with them. If you enjoyed the video and want to share it with your fellow cat lovers, don't forget to like and subscribe to our channel. Also, remember to turn on notifications so you won't miss our new videos. Until next time, stay with cats. Goodbye.